Hi, I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And today I want to talk about androgen insensitivity syndrome and women with MRKH syndrome as well, and the use of vaginal dilators. And this is a population that we tend to see in pelvic floor rehabilitation at times due to the need to do some soft tissue mobilization, some stretching, if you will, and some dilation of the vagina in order to achieve various goals. So along those lines, I just want to say that the goals really should be centered around what's functional for you. The normal length of a vagina is 3 to 4 inches. There does tend to be a little bit of lengthening of that during sexual arousal and during the sexual penetration process. But I can imagine that for women that have that syndrome, that when you're coming at it from maybe an inch or a few centimeters, and you're looking going, oh my goodness, how am I going to go from what I have now to 3 to 4 inches? And it can be really painful, if not just uncomfortable, and very frustrating and a bit demoralizing. And I'm so sorry that that tends to happen. Really what it comes down to is what your goals are in terms of intimacy and what you need for medical examination and the things that you want to be able to do with your vagina. And so dilators up to this point have tended to be hard plastic and a little bit more sticky and sometimes shorter in nature, not allowing for quite a large scope. So the Intimate Rose Vaginal Dilators start very, very small. So you can see this one is about the size of my pinky. It's about 2 inches in length, but very, very slender. And so this allows for gradual work with the dilator. We're calling them vaginal trainers now too. And our dilators come in 8 different sizes. So here are the smallest 4. And then here are the largest 4 here. The largest being 15 centimeters and about 1.5 inches in width. So when you're going through this process of working with the soft tissue within the vagina and going through dilation, it's really important to remember to breathe deeply, and you're going for a training session that is tolerable, so not excruciatingly painful, and one that you can withstand for about 15 to 20 minutes. We know that tissue will elongate when it's under a low load, long duration hold stretch. So what that means is you're not coming in hard and stretching it hard for a short period of time. You're coming in and it can be a little bit uncomfortable, but we would not want it to go into the pain region. So on a scale of 0 to 10, where 0 is no pain and 10 is the emergency room, really want it to be around a 2 and don't want to go any higher than a 4, because what can happen is the muscles can start to spasm around the vaginal opening, and that can lead to other problems with penetration later on. So putting the dilator in wherever you are, whether you're here or more in the center, and moving your way up, and just being able to maintain a nice breathing session and really try not to divert your attention. It would be really easy to want to put a vaginal dilator in and just stick it there and turn on the television and kind of space out to deal with it. And why we don't want to do that is because we do want to train the muscles to relax during penetration to prepare. So that would be the training protocol, and trying to withstand it at least 6 days a week if you can, if not 7 days a week as you're going through the process. And again, coming back to what is a functional goal. If your goal is to have sexual intercourse, then a good functional goal might be the length of your partner or just a slight bit more. So when we're looking at that, if your partner is not now and never going to be this big, then this wouldn't be a functional goal. So don't feel like you would have to push your way through a progression of dilation or training just for the sake of what the standards are, but really about what your individual needs are. So if, say, your partner is about this size, then this would be your goal, or slightly larger. And so as you're going through that process, when you're getting close, say you're at that 10, 11, 12 centimeter mark, closer to here. The last little bit can often be the most challenging, and that's when you want to really make sure that you're in a relaxed position and know that it could take some time. It could take several weeks, 6 to 8 weeks, to go from 1 centimeter to another during that process. If you have further questions about this, please don't hesitate to email us at support@intimaterose.com. We have other videos on dilation that are more broad spectrum or geared towards vaginismus, which would be a constriction of the muscles around the vaginal opening. So a little bit different than looking at that depth of penetration, though sometimes that is a component. But the breathing exercises that I've made on YouTube are really beneficial for all types of dilation and working with vaginal dilators. Thank you and have a good day.